cystic fibrosis is a genetic disorder that affects primarily the lungs and the digestive system. What it does is it makes all the mucus in your body too thick. So it clogs up your lungs with mucus, and it makes it so that your digestive system doesn't produce enzymes correctly. So like I take synthetic enzymes when I eat and things like that. I do respiratory therapy twice a day. It also contributes to sinus issues. I've had 5 sinus surgeries. But those are the main things that cystic fibrosis does. You get it, it's a recessive disorder. So both parents have to have the gene, but they don't have to have cystic fibrosis itself. So neither of my parents actually have CF, but because they're carriers of the gene, both me and my sister have CF. So as far as daily living, it's a couple hours of respiratory therapy if I'm feeling good, more than that if I'm not, and then lots of meds, especially when I eat. The main symptoms that I guess are hard or uncomfortable to experience during the day is just the coughing, the having a hard time breathing. As far as a baby goes, I was in the hospital with pneumonia quite a bit when I was really little. I wasn't diagnosed till I was 2. And we actually had to move to Indiana for them to diagnose it, which is kind of crazy. But the CF is picked up through a sweat test versus a blood test because our sweat is so highly concentrated with salt because of the way that the mucus blocks the way that the salt is processed in your body. So when I sweat, like when I exercise, when I work out, I sweat salt. So it has a little bit of water in it, but it's really salty compared to your sweat. So when kids are really little, they actually just do a sweat test on them, and they put them in like this little bubble thing with like the thing, and I don't know how to explain it very well, but they test how much salt the baby is sweating when they're really hot. And that's how they diagnose CF most of the time. It can be diagnosed like in utero, and I don't know all of the details on that. It's fairly new as far as, I mean, it's probably been out for like 10 years, but as far as I'm concerned, it's a fairly new process, and I don't know a ton about it. I do know that I have a little sister that they were able to rule out that she didn't have CF when my mom was pregnant. So I do know that they are able to do that kind of thing now. It used to be totally just sweat test. But anyway, that's how you figure out if you have CF. So I guess that's also one of the symptoms is salty sweat. So it kind of stinks because you get like your pores are open and then you get salt back into them. So it kind of like stings sometimes. That's another symptom, I guess, that I have if I'm working out or stuff like that. There's just a lot of things that go along with CF. So like a lot of cystic fibrosis patients have GERD, for example. So I have like heartburn problems and I have to sleep raised up. And then there's, I don't know, there's just so many, a lot of us have asthma too, so we have to be careful what we're around because that can trigger things. We have a lot of the meds that we take lead to other problems. So, and some of them are rare and some of them are more common. There's one medication that's an IV that I won't take anymore because it leads to ototoxicity, which is inner ear poisoning. And I've had lots of fun times in a wheelchair that I don't really want to repeat. And then there's like the Pomazyme that I do take it twice a day. I've had friends that's led to lung bleeds and they can't take that anymore. And so a lot of the meds end up giving you side effects. There comes a point when you just are like, okay, well, I'm on this medication for this and this medication for this and this medication for the side effects of this medication because otherwise I can't deal with life. And even then, like when I'm hospitalized, I get really nauseated on the medications. And my body's gotten so used to some of the basic anti-nausea meds that I can't even take them anymore. I have to take the more complicated ones that like knock me out because that's the only way I can really get through the day without just totally puking the whole time, which is not fun. So a lot of the things that I deal with are originally CF related, and then there's a lot of things that come with the wonderful scientific advancements that we've made are not perfect. So there's a lot of things that come with just dealing with the things that we have. So science and technology has come a long way in the last little while towards being able to deal with CF. Pomazyme itself is a fairly new invention. Hypertonic saline is something that I don't take, but that a lot of CF patients take. That's also fairly recent. A lot of the drugs are coming through the pipeline nicely. Orkambi and Kalydeco are two ones that are in the news a lot more than others, I guess. Kalydeco was awesome, and I had a friend that took Kalydeco, and it's helped her a ton because what it does is it targets the gene mutation that originally causes CF and tries to reverse it, and so a lot of the symptoms totally decrease with Kalydeco. The problem is that only affected about 4% of the CF population because there are a ton of different mutations that can cause CF. So that's another thing that not a lot of people know. Even the common test that you do to see if you are likely a carrier of CF or whatever, the most common one only tests for the most common 96 mutations that cause CF. So there's actually like 1,000 or so. So CF varies a lot from person to person because there's so many different mutations that can cause it. Because there's so many different things that cause it, there's so many different varying levels and things like that. And even if you have the same mutation, it's not exactly the same. So my sister and I both have the same 2 mutations that cause cystic fibrosis, but our symptoms are not exactly the same. I have a lot of problems digesting my food. My body's super picky about what digestive enzymes I can take and stuff like that, but she has gastroparesis. She can't even eat half of the food that I eat. And her lungs have historically been worse than mine. We're getting to the point where we're about even. But it's just one of those things that is totally different from person to person. I've met people that were diagnosed with CF at age 40, and I'm like, how is that possible? Like, literally, how did you live your life? Because I would have been dead. Because I probably would have been dead. Because my mutations are a lot worse in some aspects than others. So I wouldn't have been getting nourishment, and you can only last for so long like that. It's interesting to see the varying levels of CF patients and that there really is a wide range of of symptomatic stuff. You know, some people aren't diagnosed until super late. Some people, when they are diagnosed, they only have part of the problem. So they may only have the pancreatic insufficiency part of the problem. Or they may only have the clogging up the lungs problem, you know. And so it's really hard to blanket term CF because it's just so wide and varying. My daily routine doesn't look too much crazier than yours. I just have to budget time for respiratory therapy, basically. So I have to make sure I have an hour to sit down in the morning, and I hook up to what's called a vest. And it shakes. It's full of oscillating air that shakes so that I can get the mucus out of my lungs. And I do different nebulizers. I do albuterol, Pomazyme, and Pulmicort in the morning while I'm shaking, and then I just do albuterol and Pomazyme at night as far as every day. And then I can take the albuterol every 4 hours if I'm feeling sick. So if I'm having a harder time breathing, then I will often do the respiratory therapy up to every 4 hours. Then after I wake up and do treatments in the morning, basically, I go downstairs and get my meds for the day. And I've got a pretty good handful and take it with breakfast and head out the door to work, basically. I have an inhaler that I take with me to work for if I need it. I also have a mask that I wear to work if I know that one of my coworkers is sick or it's flu season, that kind of thing, so that I don't get sick more often than I need to. I usually am hospitalized every few months. Lately it's been a little bit more than that, just kind of depends on how things are going. And then when I get home from work, I cook dinner, eat more meds, and do treatments again and go to bed. So yeah, it's pretty much my day. So exercise is an interesting point, and I have respiratory therapists that love to drill me and talk to me about this because I'm not the best at exercising, not gonna lie. But exercise is really good for people with CF, actually. It's just like anyone with a heart condition is gonna work up to improving the muscle. Anyone with the lung difficulties we have is improving the lungs as they exercise. So they really like you to exercise a lot. And I've been part of various different programs and different things like that to get you to exercise. And I know my friend Summer Love is really into advocating exercise and things like that. A lot of patients with CF have to wear oxygen when they exercise. In fact, that's something I probably should have brought up. I wear oxygen at night, and then if I'm sick, I wear it more during the day. So there have been times when I've taken an oxygen tank to work, but most of the time I don't have to wear oxygen. But a lot of us have to wear oxygen when we work out because the oxygen levels just decrease so rapidly. And so it's more of a pain to exercise, frankly, right? Because you're not like, it's hard to go jogging with this thing on your back that you're like boom, 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 against you. So you have to be creative on how you exercise. But exercise is definitely a good thing. Now, I will say, I also have friends that have chronic fatigue and CF. So they have the double CF is what I call it, because, you know, you've got two different CFs, right? But it makes it really hard to exercise because if you do high intensity exercise, your body just hurts and it's really hard. You're really tired. Obviously, you're going to be tired anyway if your body's not at 100% and you're trying to exercise, right? Anyone who's sick and tries to exercise can understand that. But especially those with chronic fatigue have a really hard time balancing out things. And I know a lot of them do yoga, and they even take their mats to the hospital with them. I took my yoga mat to the hospital this last time, and I was like, oh yeah, this is great. So I know I have a couple of friends that definitely do a lot of yoga to help, because it's not super high intensity exercise, but it's still exercising enough that it's helping you with your endurance. So exercise is definitely one of those things that has to be done on kind of a personal level as far as how much you can handle, and has to be done kind of creatively, but it's definitely something that the doctors recommend as well. So CF's kind of great in some ways because it's a high calorie, high protein diet is what the doctors recommend, right? So they're actually going to be happy with you if you eat a whole pizza. So it's obviously not super great on everything in your body for you to do that, right? And there are some CF patients that are definitely a lot more health conscious and making sure that the calories, high protein stuff that they are taking in is better for their body. But because your body is burning so many calories just to breathe and function and survive, you get to eat a lot. So I try to not be too conspicuous when I go back for seconds and thirds of things. But those that are super close to me just get pretty used to the fact that I eat a lot. All of us eat a lot. Especially those, frankly, that are thinner than I am. Those with worse lung function often have lower weight and eat a ton because they're just trying to catch up. So in some ways, you can't be overly picky when you're that low because you just have to be giving fuel to your body. But at the same time, you don't want to be clogging up your body with horrible fuel, right? So there is definitely something to be said about making sure that all of your food is healthy for you. But it's also kind of difficult to make sure that you get all of the protein and the calories and the salt. That's another thing. We have to have a ton of salt because we're sweating a ton of salt that you need to replenish your body. I like to make my own food because then I'm able to add a ton of salt without feeling like it's got a ton of preservatives in it too. And my mom was really good at teaching me how to cook. I make a lot of stuff at home, but I don't know. That's just kind of life with CF. So I want to talk about the best way to support somebody with CF, because the number one thing you can do to help us, number one, don't go out when you're sick, because when we get sick, it's a lot worse than it is for somebody else. And a lot of the times it ends us in the hospital. And sometimes in the ICU. And that's not any fun. So, although there's a ton of things that you can do to help, and I really appreciate people who take the time to ask what they can do, the number one thing you can do is don't get us sick. So, that being said, obviously, I can't just avoid anyone ever who's sick, right? I still go to the grocery store every week, and there's sick people there all the time. because not everybody just avoids being out in public when they're sick, nor can they. I understand that. But if you're close to me or someone with CF and they were planning on coming over to your house, or you're planning on going to theirs, or whatever, you're planning on getting together, and you're sick, cancel it. That's just all there is to it. And along with that, understand when we have to cancel. Because there's just times when your body acts up. And you definitely wanted to go do this fun thing, but you can't. And just being a friend that is flexible with stuff like that goes a long way towards supporting. There's a lot of emotional stuff that comes along with dealing with CF. If you're willing to listen, we will probably use you as a sounding board, because it's nice to be able to talk to people. I have 2 Facebook groups full of just friends with CF that I vent about stuff that they will understand because I need a sounding board and so do they. But it's also nice to have someone that's removed from the problem as well, that we can just talk to about stuff. It's hard to balance having friends with CF and not getting discouraged, frankly, because although the life expectancy is increasing, when I was born, I was not supposed to live as long as I currently have. So it's more than doubled, but there's still a lot of people that I have met, that I've talked with in the hospital or reached out to online and have known that have passed away from CF. And so it's just kind of one of those things that it's like it should be regular, but yet it shouldn't, because it's death. Like, nothing should ever be regular about that. But you see another friend with CF pass away and you're like, this is really hard, right? And so that's really hard to cope with, having friends that understand what you're going through and at the same time saying goodbye to a lot of them. And that's something that I've definitely talked with other people about. Is just, I'm feeling really depressed. This one passed away, and it's also, not only have I lost a friend, but it's also a reminder that I'm living with this disease that kills me, right? Which is kind of depressing. So, I feel like every time one of my friends passed away, I'm just like, well, I'm not that bad yet. It's okay. But at the same time, there's definitely a lot of emotional support that just goes with the fact that you are facing death. And everyone faces death. And we don't exactly know when it will be. And obviously it's been longer than doctors originally predicted it would be, right? And the more medical advancements and scientific discoveries that we make, the longer I live and other people with CF live. So you never really know if you're going to pass away at 20 or 40 or 60. But there's still that idea that you are dealing with something that will kill you no matter what. And everyone gets in their car in the morning and could die in a car crash. You know, there's that whole anyone can die anytime. But I think there's a heightened awareness that comes with knowing that although you don't have an exact expiration date, you do have the knowledge that things are progressively getting worse. And sure, you have times that are better, but my lung functions now compared to when I was 8 are way worse, right? And so that's just something to cope with, but it's also something that gives you an added sense of purpose, because you have to do something worth living in the time that you have, because you know that it's going to be shorter than it will be for other people. And that's part of what has spurred me into doing what I have for, like, the CF Foundation, for example. I do great strides with them every year, trying to help raise money for scientific research, trying to support other people that are in the same boat as I am. Also just volunteering in the community however I can. I think a lot of us are very involved in as much as we feel like we can be for our health. I feel like even just in the things we do, there's an added sense of determination, I guess, that we are going to do this, even if people tell us we can't. There's the whole, well, it's okay if you don't finish college. A lot of people, don't finish college anyway, and we understand that with CF it's a lot harder. And in fact, I talked with the social worker about this last time I was in the hospital, because my sister is currently trying to truck through college and having a job, and they think that's nuts, frankly. But those of us that actually have the disease are like, yeah, but this is my life, and I want to live my life. And I had to take a semester off of college, so I say I finished in 3.5 years because I still finished in my 4. And yes, it was difficult. Yes, I Skyped into a whole bunch of college classes from the hospital and did all sorts of stuff that most people think is crazy. But that was something that I knew that I wanted to accomplish with my life, and I wanted to do. And there's a lot of my friends with CF have felt like college wasn't something that they were quite up to, and that's fine. But it's just an example of how, like, once we set our minds to something, we're like, I don't care, CF is not going to stop me. Like, sure, I'll have to go through all these things. And yeah, it was really difficult. I had one teacher that tried very hard to convince my other teachers that I had missed way too much school. And even though I was making everything up, that the school didn't have to keep me there because I'd missed way too many classes. And I am there anytime I can be there. But I had missed a lot of school that semester. And I was super lucky to have another teacher that stood up for me and said, you know what? Meg has the highest grades in my class right now. And she hasn't been there. And she is doing all of the readings. She is doing all the assignments. And she actually cares about school. So I'd rather her be here than somebody that's just la-di-dawing through this whole thing. So you find champions for you that have been awesome. But I'm not going to sugarcoat it. It's difficult to try to do a lot of the things that everybody else does. But we have a lot of drive and determination to do those things anyway, which I think is a good thing. CF is kind of one of those things that every time we told my teachers about it, they kind of freaked out for a second that they were going to have to like rush me to the hospital in an ambulance or something because I was going to quit breathing. And really, I've only had to be rushed to the hospital once because I quit breathing, and was because I took 2 medications at the same time that shouldn't have happened. So it had nothing to do with like regular CF stuff. I mean, I'd just gotten out of the hospital and they had failed to tell me not to take these 2 at the same time, but other than that, it really didn't have a whole lot to do with it. But it's just something that kind of progressively gets worse until the point that you have to go in the hospital. So I start out after I come out of the hospital, and I'm coughing here and there, but there's not a ton of junk to cough out. And then as things get worse, I'm having a harder time breathing. I'm getting more exhausted just going upstairs and stuff like that. And I'm coughing out a lot more. My husband's often like, it's time for you to go in the hospital. I can't sleep anymore because I cough all night long. And I know when I was living with my parents and stuff when I was little, as I started getting worse, it was time for me to be in the recliner because then I could sleep, propped up more, and coughed less the more I was propped up. By the time it gets to me being in the hospital, I'm coughing out a bunch of junk. And that's the main point of me going in the hospital, is to get all of the junk out, and to feed high-powered antibiotics into my system to kill the things in my lungs that are irritating and making it flare up. So there have been hospitalizations that were closer together than I wanted them to be, or a little bit more of a surprise than others. Last Christmas, I had a coworker who I love dearly who came to work sick, and she came in a couple days later and said she thought she had bronchitis, and I said, thanks. And a few days later, I was inpatient because I can't handle bronchiectasis on top of things. There have been times with allergies that my allergies and asthma and stuff build up to the point that they're making CF stuff flare up. And I've ended up in the hospital closer together for that reason. This last time I was in the hospital, they were like, well, it probably had a lot to do with the dust after you moved. And all that stuff that you don't even think about, that you're just kicking up. So there's not really like a specific, this will land me in the hospital, or take me to the hospital when this happens kind of thing. I mean, I have like an inhaler that's more of an asthmatic inhaler, but I don't really attack so much as just get tighter and tighter until I can't breathe. I know I've had some friends that have gotten so bad, that they've ended up in the ICU and on ventilators and stuff. And luckily, I haven't ever gotten to that point yet. One of my friends, Linnea, just got out on Sunday of the ICU, got transferred to the regular CF unit, and we were all super happy for her. And she doesn't know exactly what led up to that. But it's more of a progressive disease that maybe when she was my age, it wasn't as bad either. And now she's to the point that she's on oxygen round the clock no matter what. And when she's sick, she's on a ton of oxygen. And so it's just kind of one of those things that gradually goes downhill, and I mean, when I was little, I didn't even necessarily, I wasn't even hospitalized every year necessarily. And now it's, well, usually in the last few years, it's more like 4 times a year. So far this year, I've been in 5. And the year's not over yet. So, it's just something that is a gradual worsening, pretty much. One of the things with CF life expectancy being increased recently is we're entering a whole new realm of problems that the doctors aren't used to dealing with. So we're actually entering a phase where people are actually living long enough to do things like have kids, which some doctors are for and some doctors are against. But it poses some difficult questions because you have to weigh out like lung function on the mom, for example. Are they going to be able to handle it? Also, just how is CF affecting the ability at all? So my husband and I have been trying to get pregnant for a couple years now. And it's just hard because of the cervical mucus, which is something that, is a fairly recent realization that, oh yeah, that's a problem because, people weren't living long enough to deal with that as a problem. And males with CF are usually sterile, just because of the way things work, the way that CF affects you. And so then if you are able to have kids, there's the question of, do you take your chances and have a child that could have CF because you have it? Do you test your partner to see if they are going to be carriers of the gene? Do you just flat out adopt? Do you do IVF, and selectively choose embryos? And it's been interesting to be part of a community that is kind of researching these problems that not much is out there about because they're new enough just because we haven't dealt with them a lot. And so I don't think there's one right answer to the do you have kids or do you not have kids and do you figure all that stuff out. I think it's totally a personal decision. My husband and I have decided that we're doing foster care because my body's having a rough time and that's what we're going to do. But I really admire the CF moms that I know that did have kids, that are struggling to take care of kids, especially when those kids have CF. I know a few of the moms in my Facebook group have kids with CF, and knowing what it's like to go through it, you wouldn't wish it on someone else, obviously. But when it is something that you get to deal with, it takes real courage to be able to say you're okay with that. And my husband and I have decided that we would like to take in medically fragile foster children when they're available, because I know so much about taking care of all of the medicine side of things. And there are kids out there that have struggles, and medically their parents can't take care of them right now. And, hopefully someday down the road we'll adopt some foster kids. And I don't know what medical issues we may be bringing into our family when we do that. But I also know that my parents didn't know whether, I was their first child with CF. They didn't even know what CF was when I was born. But when my sisters were born, they knew there was a chance because they were both carriers. And I have one sister that has CF and one sister that doesn't. And our lives are all very different. But, my sister without CF just grew up with the vest that didn't work anymore, sitting next to us on the couch doing treatments and taking her little gummy vitamin pills when we all took our pills because she thought that was normal. And in some ways I'm like, oh, I'm sorry. But, in other ways, it's a good experience to be able to grow up with different things. And I want to give a shout out to anyone who raises a child with CF or with any medical difficulty, really, because it's hard. It's hard to deal with the medical difficulty just as an adult. To be able to take care of it in a kid requires a lot. And my mother is an angel. Just even now I turn to her with insurance questions and just like, how did you deal with this when I was little and you were doing this and that and stuff? But it takes somebody really special. So, well, I have to say that I get the whole, you're so positive about life a whole lot. And most of the time I respond and say, well, I don't really think so. I'm glad you do. But it definitely helps to be able to find things that you can enjoy, because there's enough to deal with therapies, with keeping up with insurance companies and doctors and nurses and all of the just daily things. It is stressful. It gets overwhelming sometimes. You just have to find ways to be able to enjoy life. And it's especially hard when you're at points when you feel like you can't do anything, right? Like, I love to cook, but I feel like I'm too sick to be able to cook right now. I've had that. and it's frustrating. That's when I try to color, and then I get to coloring and I'm like, oh my gosh, my arthritis is really hurting and I can't do this right now. And then you have to find something else. I would definitely say find things that you can do at different points health-wise that you do enjoy. Because you have to. When I'm too nauseated to do anything except just sit there in the hospital, I have to have good shows that are uplifting and enjoyable, because that's really all I can do. When I'm at home and I'm healthier and I hit a depressive rut, I go make something. Whether it's cooking or DIY house products, I make like toothpaste and deodorant. I know I'm kind of weird. But just having fun hobbies, and also making sure you always have someone to talk to. I've mentioned I am a member of a couple different Facebook groups for people with CF. I think that's super helpful. It's helpful when you're feeling discouraged and you have a whole bunch of people out there that have felt the same way before. B, it's also helpful when you have a question about something that hasn't come up in your health yet before, that you're feeling kind of scared about, or something that you don't really know what to do with. For example, if this is your first sinus surgery and you're really apprehensive about it, just posting something about, hey, this is what the doctor said. Is this normal? Is this, questions about life that other people can say, oh, yeah, and talk to you about that. As far as quotes and things that I live my life by, I don't know that I have one specific mantra, but I do have, I really like the scripture, and you can find it in several different places in the scriptures, but it's go in peace, thy faith hath made thee whole. And I know that's kind of weird to have as a favorite when I won't be whole in this life. But to me, it's a wholeness of having the peace of knowing that my Savior suffered everything for me. And he knows exactly what it is like for me at this moment, whether I'm struggling to breathe or whether I'm hiking and enjoying the moment, even if there's oxygen on my back. He knows all that. And he is there to help me be as whole as I can in this life and completely free of CF in the next. And that is awesome to me. I know there's communities out there, the deaf community, for example, that don't consider themselves broken and that's not something they want fixed, even in the next life. And that's fine. I am not one of those people. I cannot wait to not have to deal with all this. And the fact that eventually I won't is incredible to me. And everyone is given different trials, different things that they have to live with. And a lot of the times I get, well, I'm so glad I don't have that. I don't think I could handle that. And frankly, I couldn't handle what a lot of other people have. Luckily, we have a loving Heavenly Father who knew what each one of us could handle. And so that's what we get sent here to deal with. And sometimes I question whether I really was able to handle everything he's given me or not. I'm like, oh no, this isn't working too well. But I like what Hank Smith on one of his CDs, he talks about how he likes to remind, or maybe it's his wife, likes to remind themselves that their track record for making it through hard days is 100% so far. And so even on hard days, my track record's 100%. So, it may have been barely, but I made it. So I guess that's what keeps me going, is just knowing all that. There's so many people that are involved in a CF patient's life that I feel like just saying thank you to a couple of people is really hard, because the nurses at the hospital are awesome and make stays bearable. And, you know, the teachers that have been on my side throughout high school and college when I was fighting to be the valedictorian no matter what, and that were okay with me not being in class and coming after school to take tests. I've had some incredible teachers that have given me wonderful opportunities going above and beyond what IEPs and 504s said that they had to. I've had awesome neighbors and wonderful friends from the Relief Society. When I was in the wheelchair the first time, we had volunteers from the Relief Society that would come and take me on walks around the block because I couldn't balance and my parents were at work and I needed to get out and trying to get that working. The amount of people that have brought me meals or my husband meals or my family meals when either me or my sister has been in the hospital is ginormous. And it's so appreciated. The patient access networks, the people at the pharmacy that learned my name very quickly and are always like, oh, hey, yeah, I totally have this for you, and are trying to chit-chat and so what's going on in your life, and you meet them around doing other things, and they're all just excited to see you somewhere other than the pharmacy, and there's just so many people that play into keeping your life functional, I feel like, and keeping it so you can deal with life. There's a social worker, but everyone is your social network. My coworkers that have stepped in to take over my shifts when, surprise, I have to go into the hospital again. I have awesome coworkers that have been really good to work with me. I have a wonderful boss who is just like, well, you need to take care of your health. And I feel really blessed in that because I know a lot of CF patients that don't have nearly the same work environment that I do. I have been in the hospital 5 times this year for 2 weeks apiece, and I still have my job, and that is wonderful. I got back and my coworkers were excited to see me instead of being like, I'm so sick of covering all of your shifts. Did you just quit going in the hospital? So I have a really good support system. We just moved, but even I actually totally lucked out because I moved into a ward that one of my CF friends from the hospital had moved out of about a year ago. And so everyone on the ward is already used to dealing with someone with CF. And so I was like, oh, it's not going to be weird when I wear my mask to church. And they were like, oh, no, not at all. Are you going in the hospital? Do you need meals for your husband? And I was like, yes, that'd be great. So, just everyone. There's not really, I can't really narrow down, who I want to give a shout out to the most because there's just so many people. In fact, the hospital was doing this Daisy Award thing for exceptional nurses when I was in there last. And I was like, can I fill this out for more than one nurse? because I have multiple nurses and respiratory therapists and nutrition people in the hospital that I love seeing. They're used to seeing my face, that come in and joke with me. Bryce is like the best nutritionist ever. And he comes in every time he works and will just sit and chit chat with me when I'm in the hospital and he's there at the same time. I have respiratory therapists that will request me when they're working so that we can talk and stuff like that. And I just really appreciate that. So, I guess it takes an army.